This is normally supposed to be a kind of our calm before the winter storm. And now we're hitting the storm a number of months earlier than what we typically see.
Lisa Zemnick, Division Chief of Kids Express and Urgent Care for Dayton Children's, is referring to the number of visits health professionals are seeing since school started, and school nurses are dealing with many of those cases.
You can't just necessarily look at a child and say, you don't have COVID, you do have COVID, you have a cold, you have allergies. So it makes it difficult for a school nurse to know who to send home, who not to, who to quarantine and who not.
Because many common illnesses share symptoms with COVID, parents may be inclined to have their children seen by medical staff. But Zemnick says that's not always necessary.
If a child has a fever, absolutely they need to stay home. That's one of our key indicators that the child is contagious at the time. So they need to stay home until they're fever free for 24 hours. If they're feeling wonderful and they have a little bit of a runny nose, it's a judgment call.
But if your child looks ill or is having difficulty breathing, there should be no hesitation about getting them medical attention. However, the best course of action to avoid overwhelming nursing and healthcare staff
is that anyone over the age of 12 really needs to get vaccinated, because that helps decrease the number of different things they can have.
Now, medical professionals say they do want families to find a healthy balance between protecting their kids against COVID-19 and making sure they're spending enough time in the classroom, especially because absence policies have not changed either locally or at the state level. However, guidance has been released regarding COVID-19 in K-12 settings. There are various links you can find in the story below that highlights that information. Lauren Mixon, 2 News, working for you.